And I will be going in. But before I do, I got to tell you who I am. B1 Brother Moses, salute. As you see, I'm a family man, also a veteran, and a media developer. Got a jam-packed show for you today. And it starts around here with jazz. Just a dry run, so. Testing audio visual. Sound like they are, but I don't know. Let's see. Check. Let me try my phone. See if that's it. Bear with me as I work on the audio visuals. Man, I'm just gonna get into it. Hey, were you actually able to hear the music? That is incredible. I didn't know that it was coming through. It sounded like the audio was a little bit low. So I'm checking out the sound levels here. In any event, let me know how that sound quality is coming in. If you can actually hear that good jazz in the background, I have it in the accompaniment to this stream. It is Jazzing of Susie Evans Hall, available on SoundClick for download, for just for download. And so I'll be using that as an accompaniment to bring this Corona update. So, a lot's going on, a lot that has transpired. To start off, let me start here again. Stocks continue to slide deeper into the red at the open, down another 2.6%, even while measures are being taken economically, politically, and individually to prepare for the worst yet to come with Corona. I'll be providing some stories that you may have missed. A heck of a lot of those, so be sure to look at the links that I'm going to be adding to the description a little bit later. But number one on the update is while there are U.S. coronavirus task force members who spoke out this weekend, one theme was resounding, which is how prepared are our healthcare systems to deal with COVID-19. When asked by CBS Morning Show about medical supply shortages for protective gear like masks and COVID-19 patient ventilators, Dr. Jerome Adams, who is the U.S. Surgeon General, had some refined talking points. I'll be bringing that out. The $2 trillion stimulus bill has stalled in the Senate. Oh, too long? Oh my goodness. there. I think I may have turned the game down just a little bit. Maybe that is something that helps. But let me know, can you hear that? Check, check, check. Audio sound quality now. If I can get any feedback out from here. I got mine in. Oh, let me try to see if this might work. It's a no on the volume. Let's see what I can do about that. Appreciate the feedback. Check, 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 check. And that still sounds like it's at the same volume that it was before I tried it. Let me do this. In that. Give me a hot second. Now, where is it? It would be that one. It would be that one. And it would be audio playback volume. Okay. Take two. With Miles Davis cutting loose with the band, stocks continue to slide deeper into the red at the open, down another 2.6% and decreasing, even while measures are being taken economically, politically, and individually to prepare for the worst that is yet to come with coronavirus. Now, there's going to be some stories that you may have missed. And so I'm going to give you about 10 of those in 2 minutes, but then I'm going to go in depth on quite a few others. But the number one leading story is this United States Coronavirus Task Force, which also spoke this weekend. One theme is resounding, which is how prepared are our healthcare systems to deal with COVID-19. Now, with that new intro, feedback again. Take your time. How was that mic level? I appreciate it because I will be presenting on the B1 network just a little bit later. I'm trying to get all of the bugs and kinks worked out here on the smaller platform, so that way it's a go when we get to the louder. When we get to the bigger platform. So appreciate your feedback, Kenya from Cali. What do we got now? When I came through on the second time, how was that when it comes to the volume levels? And for some reason, I don't even get my own notifications on my own phone, I promise you. I'll give that about a minute to kick in. And while I do, let me continue the presentation. So you have mic level is good now. All right. Then let us continue. So, we talk about Dr. Jerome Adams. He has some refined talking points. We'll get into it. But other news, the $2 trillion stimulus bill has stalled in the Senate. Voting is scheduled for around noon today. Trump approved the New York, the Washington state, and what about California's national disaster declaration requests? Why are those important? Because they will allow the National Guard to deploy with no cost to the states. FEMA Administrator Pete Gaynor came in and said that is not a declaration of martial law. I beg to differ, but to each their very own. Call it house arrest, if you will. Next one, the Fed bolsters financial preparedness. That's what's up, Midtown Salute. I'll be going on a little bit later, just getting my mic levels and everything good. All right, so the Fed bolsters financial preparedness, helping the commercial paper and the money markets by cutting interest rates and then pledging to boost holdings of the treasuries by at least $500 billion and of mortgage-backed securities by about $200 billion. The Federal Reserve Bank of New York says as much as $50 billion per day this week is what they're looking to buy. So we see that quantitative easing still, or revisiting of the quantitative easing approach and ramping those up, perpetually no ceiling on the amount of funding that they are willing to put forth. You know how I feel about that as somebody who's been an advocate for reparations. I feel like they've dodged that question and deflected from it so many times that we got to be willing to force them to have that conversation again. I digress. Meanwhile, economists see unemployment predictions soaring to around 30%, and analysts across the gambit expect continued volatility in the markets. A 14.95% decline in the S&P makes last week the fourth worst weekly return since 1927. So I'll take 2 minutes to give you some stories to corroborate this information that you may have missed. Forbes staff chronicle economic impacts. Now, Bank of America, they're talking about how many people may file for unemployment benefits. They also have some home forgiveness and foreclosure assistance and all of those type of programs, as well as Wells Fargo. We'll get more on that from the HUD director a bit later. The celebrity fact still in full effect, as we know. Coronavirus Relief Fund, which unites 100 plus sports from across 20 different sports to donate their memorabilia. Over the weekend, the number of tests administered and given as a result surpassed 254,000 tests total in America. Involuntary testing may not be off the table though, so keep that in the back of your mind. Mainstream media provided in-depth coverage in places like Chicago, more than 1,000 confirmed cases. Africa had to get on in there. Private companies and their loopholes first, and how they're curtailing privacy rights and HIPAA, I would say. Europe is left to fend for itself. You'll get a lot from Germany right now in these coming weeks. The technology race was kickstarted as we have that public-private consortium developing, looking to bring in some AI and get some more of that testing results faster. STEM, as you know. And then, of course, the journal.ie joined the worldwide project of fact checkers. Facts, not fear, is going to be the campaign put out this week. I promise you that. So media fact checkers debunking information. Why does that sound familiar? Well, because the B1 Network, when we deliver content, that is exactly what we do. So those are about 10 stories that you may have missed. And with that, it was about 2 minutes, but I do have a broader presentation. Disclaimer, yes, there are some screenshots used from across the web whose work should be better cited than I've prepared in this presentation. I do want to make that disclaimer, as well as the one that says all rights are reserved to the copyright holders of the material which has been adapted for this presentation. It's going to be my Coronanoia update. Brother Moses and I finished it March 22nd, 2020. I was looking to present, but I got a little bit more information. So Texas, the third least aggressive state. When it comes to disaster preparedness, I would think Texas would do better, given Galveston and so many experiences that their people have been under. So we may have to look outside of the traditional outlets to piece together the valuable information we need. D Magazine is a good source as any, given today's climate. I could be wrong, but let's check out some of their uncommon analysis. Look, they looked at a study analyzing data from the United States Census Bureau, the Bureau of Labor Statistics and such, and as they started to gather some information about that information. They did not cite a government agency for publishing this information. They used WalletHub study, inserting the per capita argument into this analysis. And so a couple of things that they were looking at there were looking at validating this bigger storyline here, which is 75 million Americans who are ordered to stay home. Oh, you know what? That is something that makes this a bit complicated, because my note page is giving me the notes for the page that will come rather than the page that you all see. So there will be a little bit of lag there. I guess we'll make it work. All right, I found the study to be a thorough enough examination. I particularly like their approach as they looked at the weighted average rankings that were based. You see 19th there, state and local public health response capabilities and such, and or a number of laboratories able to process information. That was a pretty good source there looking at Texas, number 51, or like three from the bottom. What say you? A state like Texas, as big as it is, we already have 75 million citizens. If you throw Texas in there to try to make their efforts to jump towards number one, what does that do to the overall economy? Anyway, I'll keep it moving. Coronavirus update. My previous update highlighted responses from these two. Someone I didn't even know who was in leadership, which is Dr. Jerome Adams. In his speech, Dr. Jerome Adams gave some valuable insight into the public health ramifications with his interpretation of higher risk, lower reward. There is context to why he presented, and you can check out that March 18th stream available on Taz Exclusives, the teacher channel. For that timestamp around 25:30 is when I got good into my preaching. But there's also the coronavirus update streamed March 15th. It was 11 hours, but you can check that out as well. But to recap, Adams said we shall overcome. It was some powerful rhetoric. I still feel like the leading Black conservatives are used as tools for deflection, saying things such as stop touching your face and all of those other things. Reflections. Let me see. Despite my critique of the nation's doctor, his prescription to preventing the spread is on the record. His simple message read loud and clear, but were we actually listening? Okay. There's something there. His message, stop touching your face, practice hygiene and wash your hands, practice social distancing. Did the message go far enough? Well, Michigan has 790 confirmed cases now, and Whitmer feels she was one of the first to get aggressive by closing schools. Well, there are more extreme versions of the coronavirus response that she was asked to consider. Now she's advocating for a partnership with the federal government and a national strategy to help keep people safe, to get more masks and test kits, and to get more ventilators. They need them in state-sized quantities, and they even had an infant that tested positive for COVID-19. Now, you remember I brought out Michigan Governor Whitmer, because of how she evaded the martial law question. She said, I think we have to make decisions on whether facts and science dictate, Whitmer said. At this juncture, it is too early to make any statements. It would not be responsible to make any statements on that front. And that's when she was asked about declarations of martial law or locking down Michigan. Quick pulse. Next section then, shutdown orders. Surgeon General's warning that this week it's going to get bad. That's how these headlines kick off, is with my guy Jerome. 45 provided a little context around the National Guard deployments, but I got to get you the actual data. So rock with me. This one. All right, so that's what I'm gonna have to do. I may have to put these later. All right, context. On March 2nd, CBS New York aired footage of this speech. Our boy Jerome joined Governor Ned Lamont and Connecticut's health officials to address their state emergency's preparedness plan. He said, we have a playbook that we are following. He praised this administration's containment strategies to limit the spread. Surgeon General helped people keep things in perspective by discussing those risk factors, comparing it to the flu and talking about hand washing, elbow bumps, social distancing, and other steps people can take. He also advised the state and the local level that we're not there yet regarding closures. That was on March 2nd. And so on this next slide, I want to show you a chronology of events from the leadership there in Connecticut. Governor Lamont, who signed an executive order asking Connecticut businesses and residents stay safe, stay home. On the right, you will see those executive orders. March 10th. Executive Order number 7 dated March 12th. Executive Order number 7A dated March 13th. Executive Order number 7B dated March 14th. To mitigate the critical shortage of hand sanitizer and personal protective equipment, maintain and increase the availability of childcare, and provide for increased healthcare resources and facilities. Moving forward, he says, whereas in a short period of time, COVID-19 has rapidly spread throughout Connecticut, necessitating updated and more stringent guidance from the federal, state, and local officials. Again, he asked for more stringent guidance around the 23rd. This is his executive order. Restrictions on workplaces for non-essential businesses, declaring businesses essential or non-essential, effective March 23rd, which is today, at 8 p.m., which is tonight, and through April 22nd. Woo! Unless earlier modified, extended, or terminated by me, all businesses and not-for-profit entities in the state shall employ to the maximum extent possible any telecommunicating or work from home procedures that they can safely employ. And I would tell you all that some of that also means furloughs. And you're fired. I got to zoom this one in right here, Kenya from Cali. Restrictions on workplaces for non-essential businesses, March 23rd, 8 p.m. tonight through April 22nd, 2020. All businesses and not-for-profits. And as he is asking for more stringent guidance from the federal level, another brother comes in, which is Dr. Ben Carson over the housing and urban development. That update, he gave some information around exercising mortgage forbearance, covering all 8.5 million people. He says, we cannot mandate this, but they are petitioning Congress. Now, we've seen things that go through Congress stall, such as that stimulus relief bill. It stalled in the Senate. April vouchers will be sent out next week, he says. May's vouchers are in the works for low-income housing. Also said something about extending the deadline for healthcare borrowers. I don't know why he would be mentioning that, but I guess it was relevant. He said one thing that struck a chord. He said there was a sense of unity that we haven't seen for a long time in this country. And so on that note, plan to build in a 2-minute survey, as you've seen from Dr. Jerome. And then now they bring up Ben Carson from the Housing Urban Development saying, I can't mandate it. And what he's talking about mandating is those banks and that rent that is going to be due, despite the fact that those folks have been ordered by the federal and state governments not to go to work. And so that 2-minute survey would entail, are Black conservatives running deflection while that bigger agenda is going underlying agenda is still going forward? Yeah, I got to tighten that section up. Wow, there's a couple of key takeaways that I have from this presentation preparedness plan. Number one, I need to move my notes to the previous slides, because on the screen that you all see, my notes are delayed. In any event, coronaviruses raise tough immigration issues for businesses. As you look at this picture here, you don't see either of those two brothers who, number one, Dr. Jerome Adams is a part of the U.S. coronavirus task force, but he was not pictured here. But he has some improved talking points, such as flatten the curve and social distancing. If you watched the CBS this morning, they went at him a little bit. They charged him a little bit. He tried to go into the whole, and I have friends who are in the healthcare space. She was like, with all due respect. And with all due respect, had to cut the brother off. I would love to play it, but they don't like it when we actually, spread that or share that information live on some of these streams. And so one of those talking points was about this here. This is an adapted graph or bell curves, and it's showing that healthcare system capacity and the number of cases that they could effectively treat. And then that is measured without protective measures and then with protective measures over time since the first case. On your screen, you see the adaptation by the CDC. Now, it was coined by Becky looking to simplify a complicated talking point. She was looking to answer this question: at what point can the number of confirmed cases exceed the capacity of our healthcare system? I may need to move this one up sooner. I like this one. A major concern also highlighted by the BBC, among other topics. You can also notice here that Germany made the headlines as well. But then when you look at that earthquake event in Croatia, that should trigger some of our theologians in the chat. More updated information for analysis will start right now. It's now available via the CDC and the Johns Hopkins University website. Start you off, I know you remember that this graph right here was showing the increased number in tests that have been administered. But remember the chart from the previous update. As more patients are tested in public health laboratories, I Texas, the total confirmed cases will continue to rise. Obviously, the person must have previously contracted coronavirus first in order to test positive. Data by the end of the day on 3/22 shows about 336,000 confirmed cases in about 173 countries. I'll spend significant time here breaking down this high-level data for more comprehensive analysis. Oh yeah, I need to jump straight to this one. So Don Cato, when I present this a little bit later, I'm gonna jump straight to those ones. I think I'm gonna move down the section. There's something in between the 10 stories people may have missed and then getting to the actual big case. And I'm gonna take that out and move these ones up. 20,000 more confirmed cases a day moved us from 4th to 3rd on the list of countries. As you see, Germany is right below us due to their being on their own. Since yesterday, not the increase is nearly 50,000. Oh, since yesterday, the increase is more than 50,000 more total confirmed cases. See, I actually started my research for this presentation on the 21st, but I'm going to be taking a deeper dive on this information here. I did want to actually show it and share it, since not everybody would have access, or not everybody can look at those charts and see what that information is telling them. But this brings us to our first Mythbusters update. Is the mortality rate of the coronavirus less than the flu? Let me stop right there. Dr. Ted, that was our dude, said, we have seen a rapid escalation of cases of COVID-19. More cases and deaths have now been reported in the rest of the world than in China. We have also seen a rapid escalation in social distancing measures like closing schools and canceling sporting events and other gatherings. But we have not seen an urgent enough escalation in testing isolation, the contact tracing, which is the backbone of the response. Wow, why can I not say this guy's words in totality? I'll just put them on the screen. So first, consider Dr. Ted the highest authority in the world on world health. Also, consider Dr. Ted made his agenda clear when the World Health Organization raised those concerns. They raised the global virus risk to the maximum level around 2 weeks ago, more than 2 weeks ago, because it's been a week since I've actually presented on Dr. Ted, which is the Director General of the World Health Organization. He's the expert who gave the world its first good taste of coronanoia. Well, him, and then you can also include Bill Gates in that. In his opening remarks, the number is likely lower than 3.4% for some groups, but remember, some groups will have a higher mortality rate given those risk factors stated by the U.S. Surgeon General Adams. I speculate here. Take, for instance, an older person with chronic medical conditions, and let's say indirect prolonged exposure to a carrier whose symptoms have progressed into a full-blown case of coronavirus or COVID-19. For the most part, the mortality rate is still uncertain, and the said scenario seems to be of a low probability. But rather than look at the expert Dr. Ted, we got a little bit of pushback, which came from 45. He said, now this is just my hunch, but based on a lot of conversations with a lot of people that do this, because a lot of people will have this and it's very mild. Go back. Oh, yeah, you can see it. He says this is Trump on March 4th. So March 3rd and then March 4th, giving you that timeline. You never hear about those people. So you can't put them down in the category of the overall population in terms of the corona flu and or virus. Okay, so yeah, I can do this one big right here. All right, so he's basically saying a lot of people won't even get tested. They won't even call a doctor. You won't hear about them. So you can't say that the mortality rate is higher or lower. So you just can't do that. If we have thousands and hundreds of thousands of people who are just getting better, you know, sitting around and even going to work, or some of them go to work, or some of them just get better. And then when you do have a death like you have had in the state of Washington, or like you've had one in California, I believe you've had one in New York, he says, let me see. Damn, he says a lot on this one. I believe you have one in New York, you know, all of a sudden it seems like 3 or 4%, which is a very high number as opposed to a fraction of 1%. But again, they don't know about the easy cases, because the easy cases just don't go to the hospital. They don't report them to the doctors, and the hospitals just don't get that data. And so he's saying, you know, 3 or 4%, which is a direct pushback to Dr. Ted. He uses as his analysis those people who will contract coronavirus but not have it escalate or develop to the point of COVID-19, which is the respiratory infection. It was an interesting pushback, saying a lot of people won't go to the doctor. A lot of people will continue to go to work. A lot of people will do a lot of different other things rather than get tested. And essentially, we can break that down. Worldometer coronavirus cases, 301,000 as of March 21st, when I first started the information. We can start with that total number of cases on a linear scale, and on that scale and on that timeline, break that out by number of recovered and then number of deaths as one category. Oh, this section is where it's going to get even more complicated, but I'll try my best. Let me run those back. All right, so what it is, we got to give this dude a fact check. What do the analysts say? My bad there, third degree burns. I'm trying to get the cadence together so it's a little bit easier a little bit later. So source, Worldometer. It's one of the sources for Johns Hopkins. Here, we'll be breaking down the data even further so that no one can say we're spreading misinformation on the B1 network. I can probably bring this one up a little bit too. We'll start with the total number of cases on a linear scale. Those are two hard words to say. With the timeline on the bottom indicating total confirmed cases by day. As of 3/21, one way that they analyze how deadly the coronavirus is based on closed cases, or cases with an outcome recovered or discharged. That was around 94,000, or just around 95,000. Note that about 13,000 deaths, too fast still, does not equate to a 12% mortality rate. So again, while people might think that it's higher, they'll see that number that says 12%. They're thinking that 12% of people who actually contact coronavirus, or contract is the word, coronavirus, are actually dying from it. But that's not the case. This is a percentage of all closed cases, meaning there are many cases that are actually still pending. I'll show you again the cases that are providing rich data to better understand COVID-19. And this is not to alarm you, but to inform you. That's what you're going to see on the very next slide. This one I should have gave more time to. 184,000, around 185,000 have mild conditions of those who are currently infected, and about 10,000 serious to critical condition. Removing recovered and deceased folks leave active cases and who are currently infected patients. And so those are those bullet notes, 194,000 active cases. From what I've gathered, it looks like they're trying to establish correlations based on the number of active cases. Blue being the larger group of confirmed cases that exhibit mild symptoms. Green being recovered folks who don't know if they can still infect others. And then red being those patients with severe symptoms. More information is still needed in order to confirm which group is the most contagious. And are the red group the most contagious group because they're at that stage of COVID-19 where it is a respiratory disease? Studies from confirmed cases active and most likely experiencing intermittent discomfort and mild symptoms, the total recovered and deceased. Crap. I am struggling with this presentation. I'm glad I tried to run it once on a smaller platform before I took it to the big. Yep, Don Cato, worldwide. I'll be sure to emphasize that. Thanks for the feedback. Well, these ones are challenging. I got to make sure that I'm able to drive these ones home, so I'm going to run those ones back. All right, this is the fact check section. And so we got the Dr. Ted, then we have 45's response. But what do the analysts say? From the source, Worldometer. Here, we'll be breaking down the data even further so that no one can say we're spreading misinformation on the B1 network. Why did I move this slide so fast? Total cases. As we see that increase in cases, I need to give all of these slides at least an additional 5 seconds. Just to let the information breathe. It is deaths worldwide, but it can get more granular, as we'll see as the presentation builds. See, these numbers that you see on the screen would just be the headlines that folks would see, the total number of deaths, total number recovered, and that's what they're going off of. But more data is actually needed in order to understand mortality rates, even the incubation period. And that's what I'm hoping to drive home with this section of the presentation. And so one way that they look at it is by taking the recovered cases, and they also just look at the active cases being 194,000. They break those down between those who are experiencing mild conditions and those who have serious to critical conditions. That's where you see they got the total of around 195,000. They're looking at it from this lens, which is a level of contagious. How contagious are you when you're only experiencing mild symptoms? The green are the people that they said are supposedly recovered. Are they still symptomatic? And then those in the red who are really experiencing it, those are the ones who are driving the healthcare scare. If that number of highly contagious, if it is correlated to highly contagious, and they are the ones who need hospitalization, do you have the number of beds needed, ventilators? Do you have protective gear needed? But I'm gonna show you where they actually get those studies from. See, maybe I just need to talk about it like this rather than depending on my notes, which is where I think I may be falling short here, is just to have the conversation from what's on the screen. because it does take it back to those studies right there in China. Potential explanation, we know, comes from those early responses. This was the epicenter, as they said. So you see, this is all the way back on February 7th. China's National Health Commission reported details of their first 17 deaths. They give you the different age ranges to which people, and then when they go into the symptoms, they bring up ARDS, or acute respiratory disease syndrome, something like that, was around 8 days. And some of the symptoms that they were actually experiencing. And so while they were in the same sense trying to get this information together and treat these cases, they were also trying to get their documentation methodology down. Mortality rate as of February 20th in China, it was based on 55,924 laboratory confirmed cases. See, this is how you fact check. The report notes that the Joint Mission acknowledges the known challenges and biases of recruiting crude CFR early in the epidemic, or the case fatality ratio. And then they also had how to calculate the mortality rate during an outbreak, which is a hyperlink that I actually selected on. So again, folks who just want to start at the top and look at the total number of deaths and say these deaths are compared to the total number of cases, that would be a misnomer, as well as looking at it from the daily deaths, which is information that they do have. More importantly, though, it drove the conversation to research into more critical areas of concern. But when you click on that mortality rate, how to calculate it, they say at the present, a precise estimate of case fatality rate is therefore impossible. And so neither the president nor the director general of the World Health Organization can say what that mortality rate is. Is it more or less than the flu? No, we're supposed to let the information breathe here, but how is it contracted? How long does it live on surfaces? Now, for this one, I was going to jump back to the previous stream, show a little bit of what I was saying there about it being on packages. It's not just people, but also on products. And so it's important for us as a consumer-based economy to understand how long COVID virus can survive on products and the type of materials that it can survive on. Again, this isn't to alarm, but to inform. Asking for the vital information. As you see, Johns Hopkins University of Medicine, COVID-19, they actually have a Q&A. How long can COVID-19 live on surfaces? So let's take a moment, let that information sit in. It's one of those heavier stories, and then we'll get back to some lighter information after that. But credibility statement first. Carolyn McAmer is a cell biologist, a professor there at Johns Hopkins School of Medicine who has studied basic biology for coronaviruses for years. I know somebody puts in the chat, coronaviruses, that family have been around since 1965. And so one of those professors in cellular biology, I'm not just Brother Moses bringing you my own perspective, had an opinion. In her own words, what's getting a lot of press and is presented out of context is that the virus can last on plastic for 72 hours, which sounds really scary. But what's more important is the amount of the virus that remains. It's less than 0.1% of the starting virus material. Infection is theoretically possible, but unlikely at levels remaining after a few days. People need to know this. So what did she say? Did she actually give a number, or did she say after a few days? Did she say it's important to know how much of it exists? Tell that to those people who may be advocating for more protective gear. And in fact, tell that to the workers of Amazon who are distributing these packages. See, there's been speculation going on. Next question, the speculation about the temperatures. How does that affect COVID-19? So that's another myth buster. She says, there is no evidence one way or the other that the virus viability and exposure to heat or cold has not been studied. See, remember, this is something that within our time frame, we only got through the cold season, even there in China. Not a direct answer to the question, but it is a myth buster. I'm gonna put a little bit more energy on that for the myth busters, and maybe I can pull the 2 myth busters up as well. I think I like those ones, 2 myth busters. We'll keep that in there. Future topic: to be or not to be tested or vaccinated. That's what's coming up next. Yeah, you know what? I don't think I actually need to use my notes as much for this. My notes are good. My notes are data-based and actual quotes and all of that information, but I don't think that it will be necessary to actually read from my notes. I think that should help streamline it. And then even then, there's a flow to this presentation that is already pre-programmed that I'm naturally fighting against by trying to read from these notes. So we'll just continue as it is and move on forward. Future topic: to be or not to be tested or vaccinated. Should Americans, emphasis on the I, use antibodies from recovered COVID-19 patients? I even put the link right there on the screen for you. Chair of Bloomberg School of Public Health is helping organize a national effort to use antibodies from recovered COVID-19 patients for protection and treatment until a COVID-19 vaccine is available. And we know from some of these stories that they're projecting out 8 months, 9 months, a year or more until an actual vaccination is available. We've even had speculation of using malaria vaccination to try to treat this one. Like, what in the hell is Corona-noia doing to some of our smart people? Emphasis on the I. Ask yourself that question. Should I use antibodies from recovered COVID-19 patients? And again, keep in mind that right now it is completely voluntary whether or not individuals test. But involuntary testing is not off the table. You had that tech company that was in the top 10 stories that we may have missed that can pull shit out of the sewer and test it for coronavirus. And they have a whole startup company on testing fecal matter. I gotta show you the screen there. Johns Hopkins Global Health now lets you know that I'm not making this up, as they're looking at preventing the spread of the respiratory disease, preventing it from becoming a full-blown COVID-19 respiratory infection. I'ma just let it zoom in there. This is the chair of the Department of Molecular Microbiology and Immunology, Bloomberg School of Public Health. Remember that. That's important. Zoom all the way in, if you will. I don't want anybody to miss that. A stop and go solution. A national effort to use antibodies from recovered COVID-19. Would you want that shit in your body? Pulse check. Forbes top stories that I was able to pull out. Now, remember, it was the Bloomberg Public Health, or, Bloomberg invests in a lot, including academia and philanthropy and hundreds of millions of dollars on failed presidential campaigns, as well as spending $75 million to fund New York City nonprofits. I don't know if he spent the whole 75 million or if that was just the total amount that the fund was going in on. And so I had to dive into that story itself, man. Bloomberg. Oh, God. Mike Beasy. What's good, Bubba? So this is the Forbes story. Their trademark or whatever it is there because I do want them to actually get the credit and the copyright for the information that was spread. And hopefully is actually delivering on this type of information. But I got to bring it out for our network here. Because as you see, he was joined by some others in propping up this new trust. Cosmetic company Estee Lauder's charitable foundation, and Jonathan Soros, who is the son of hedge fund tycoon George Soros, also contributed. They're looking to provide grants and interest-free loans to small and mid-sized nonprofits with annual budgets up to $20 million. Now, how are you going to help someone with a budget up to $20 million and you have $75 million that you're looking to put out there? What is actually, well, you got 5 people in mind? Anyway, it's not my business, but it is available. Budget can go all the way up to 20 million, not including government contracts. So New York City itself has 662,000 nonprofits that stand to benefit. Organizations can receive aid for a variety of expenses, such as laptops and conference software needed for remote work. And then don't forget the temporary staff support to cover those expenses. So that's the New York Community Trust about the New York COVID-19 response and impact fund. You can check out their website as well. I also have a link for that one that I'll be putting in the description. Brother Moses, if you have time, watch Event 201 segments 1 through 5. Will do, Don Cato. You know, I'm about that information. And so this is where I've been focusing my weekend. I do want to build inside of the presentation a shout out to the Ziyex Institute right there in New York. One of those could be not-for-profits that could stand to benefit new laptops and then some funding there for the members that are supporting and those volunteers. Maybe they can get some lunches and things. But went to the website Ziyex Institute, a phenomenal website, Q Butters. Online curriculum. Enrollment process is pretty seamless. It's all built in. You can also donate right there. I would say that making this website IG scrollable would be a good idea. And that would be a good idea for any of those small businesses out there. Make your website IG scrollable. So the main pages and maybe the one hyperlink that you want built inside of that IG scrollable. That way people can just move with their fingers. If it's only 5 to 6 pages of information you want to share about your small business, make sure you have that in a IG scrollable format right about now. And the hyperlinks. Don't forget the hyperlinks to the actual website. Make sure they land on the page that they need to land on, i.e., if it is a payment or a donate now button that they're landing on, if I click that hyperlink, I should land on a payment portal. All right. And then the other thing that I noticed about that is that there's enrollment, but is there an a la carte menu of available courses right now? Does QButter have an online library of you know, some of the presentations, some of the information, some of the classes, the coursework that's available right now? That's another one. I know in a lot of these competing spaces for online education, they have PDF files available. That would be another good one to create access for an all virtual course library. Shout out Ziyex Institute. And so we also have on Forbes lighter stories, social distancing is changing the way people use dating apps. That was important to me to bring out because one of the channels I follow is O'Shea Duke Jackson. That vlogcast channel is a multi-sectional or multi-sector platform for discussion and debate. I like it because it brings together folks from an international sphere. One house, particularly on Sundays, the Sunday Rumble show brought out this information about the use of dating apps and how coronavirus is impacting the dating online market. It was also published by Forbes on March 19th, a story about how social distancing is affecting the way people use those dating apps. The person on the Sunday Rumble said they got 50 more likes or matches or whatever they call them. We'll keep it light. 3M ships more than 500,000 N95 masks to New York and to Washington State, but Seattle more specifically, as it cranks up its effort to deliver on protective gear. That's that public-private partnership in action. The federal government will pay for National Guard troops in California, New York, and Washington. What about Connecticut? I thought they had a good case there. Buzzword, social distancing. Remember that one. And also remember flatten the curve. That is the new talking point. Flatten the curve and social distancing. And I'm still wondering how they're going to rephrase or package this martial law order when this stay at home. I know they call it stay at home. I don't know if what part of it they'll focus on. Is it it feels like house arrest, but what will they call it specifically? To taper the coronanoia from people saying this feels like martial law. If you've closed down all the businesses, you've closed down all the schools, you've closed down the parks, all non-essential businesses, if you've closed our access down to those, what are the next steps? All right. And so for those who may be dealing with that level of coronanoia, those who may be living in some of these states where the National Guard troops have been sponsored by the federal government. I like that very last one on the bottom right, which says, calling all people who sew and make. You can help make masks for 2020. It almost sounds like the 1920s. You got to do your part to fight coronavirus. I think that's going to be the next thing, is some type of work from home type thing of creating a product or a service for a high need area impacted by the coronavirus. That will be the next thing. Not only do you try to subsidize some level of job loss, but then also the creation of other jobs. That would be the next thing if you're predicting 30% unemployment. All right, next up. Testing. Access to the COVID-19 genome sequence. Manufacturing test kits, distribution of test kits, and prioritizing and tracking patient testing. We already got access. That's out there. That's digital. But let's break down this information using the data adapted from Johns Hopkins University sources. It's, in fact, still a high-level analysis to look at U.S. data. So somebody asked me, were those global deaths earlier? Yes, they were. But when it comes to the COVID tracking project, that is another source from Johns Hopkins University. They do have total U.S. data. Positive number of cases, 24,000. And this was, this was as of 3/22. That's important, right? Because the U.S. task force guy said it was around 254,000 tests administered. So 24,000 is just about a 10% infection rate. Now, I can't tell you the mortality rate, but I can do the simple math there. Of the number tested, how many tested positive? Now, that is a number that you can divide. How many tests showed out to be negative? About 167,000. Hospitalized was around 2,101 cases. Deaths, 296. And so again, if the white space is all the people who got sick from coronavirus but didn't get tested, then you have the red space being the total number who actually did get tested and confirmed, and then that green space being the total recovered. And a very small percentage of that would be the black, or those who actually died. But it is a percentage nonetheless, as we look to break down the coronavirus. Sterilization efforts, man, I got like 3 different stories that we're talking about that, where they closed down their what do you call them? Breweries, and turned their breweries into businesses that create hand sanitizer. Again, public-private partnerships. All I know is the symptoms sound painful, shortness of breath and all of that. And so I needed to take me a more introspective look, get some responses, not just across the US, but across the world leadership. And then I was able to look right here in my own hometown of Arizona. We have the Mayo Clinic here, which operates a large facility. And so they put out a quick, easy picture that I'm gonna share with you here. I added some of those icons there and those key terms. which is number one, ingestion. How does it get into the lungs in the first place? And that's why they're saying, wash your hands and don't touch your face and all of that. Incubation is the time it takes for however much you've ingested of the coronavirus itself to actually flourish, to replicate itself and grow to the point of becoming COVID-19, which is the actual infection. I'll show it again because they actually have the medical terminology there for your bronchioles and your alveoles and all of that. And they show you in the lungs there, the sacs where it actually stops and it fills up there, and then it reproduces there to the point of being able to burst one of these and start to do more or get into other parts of the body. But once it starts to fill up in these sacs, which is where your oxygen is, then what? Wanted to give another micro example. This is another one of those places that counties rather that have not jumped all the way into the more aggressive. But as you see here, it is still relevant. They have recommendations. So yeah, I will be able to present this in less than an hour. So even with all of the delays and the mishaps in this presentation, it is going to be less than an hour. So that's good news there. Effective close as of business Friday, March 20th, all restaurants in Arizona counties. And then they did it specifically with confirmed cases. Raviolis, archeoles, all of them olies. All movie theaters and bars and gyms are required to close. But you see, they had the caveat with confirmed COVID-19 cases. Halt all elective surgeries. So they hit the medical or the healthcare industry directly. If someone in your home or your family has tested positive for COVID-19, keep the entire household at home and contact your medical provider. So there's some things that are out of place there. If someone in the home has tested positive, the people in our homes haven't tested. Keep the entire household at home, okay? At home or house arrest or whatever it is. First of all, they haven't even tested. And then contact your medical provider. What we experiencing is the number of false positives or people who were just sick trying to contact their medical provider. He did something with the driver's license, statewide closures of Arizona schools through through Friday, April 10th. And then even after that, a whole lot of other measures that they're looking to recommend. Recommendations to cancel or postpone mass gatherings of 10 or more people, and then recommending telework and other alternatives when available. Another one, March 14th, 2020, Virginia Department of Health and the Peninsula Health District reported the death and hospitalization patient who previously tested positive for COVID-19. That was their first death. Patient was a male in their 70s, contracted it through an unknown source. The cause was respiratory failure. So once again, this is not to create alarm, but to inform people still not understanding respiratory and thus not allowing our family to access tissue. Stop buying all the damn tissue. Jeez. Public health officials reaching out to all identified contacts of COVID-19 cases. So that's another issue there altogether. The Pennsylvania Health District was working very closely to identify people who have been in potential contact with people known to have tested positive for coronavirus. So even though it's over 254,000 people who they said had been tested, out of all of those people tested, they get a number of people who test positive. And from those people, they are interviewed. It says here in Virginia, they are interviewing affected people and giving instructions on how to protect themselves and others. And so they have more recommendations, even if they find out that, so they interview the person. This person says, I have 10 people that I can list that I have been in direct contact with. Out of those 10 people who's going to actually make that phone call and let them know that they have potentially been in contact with someone identified to have contracted COVID-19, that they may be at risk, and to give them the next instructions for protecting themselves. And again, saying stay at home if you feel sick. Curfews. This is Augusta mayor. So it's not just at the highest level, but even in places like Augusta, who says if we were to implement a curfew, we have some general idea of what that timeline will look like so that we can get people off the streets. Augusta leader considers additional steps such as curfew to flatten coronavirus curve. Augusta? Damn. So at the conclusion, we still left with this question on whether or not the big I, or should Americans, the big I in Americans, get tested. What do you actually feel about that? Throw my new avatar up. And I am going to get ready to go join the B1 network. It is streamlined. It is less than an hour. It will have all the pizzazz, the funk, and the pop on the next one. Thanks for rocking with us as we do our dry run, looking at the economic, political, and social ramifications of the coronavirus. The social, political, and economic impact of the coronavirus. This has been my Coronanoia update here. More to come later. That's all I got, and I'm out.